In New South Wales, the government's escalating its response to COVID-19 if the pandemic worsens. In fact, I've just received notification from New South Wales Health stepping up its advice to those that have travelled. Anyone who's been overseas in the last 14 days has been asked to practice social distancing, to avoid mass gatherings and to avoid small gatherings. So basically to isolate essentially, but that's for anyone who's been travelling overseas recently in the last 14 days, and to practice social distancing from other individuals. Let's go live now to the Shadow Government Services Minister and former Labor leader, Bill Shorten. Mr Shorten, thanks so much for your time. I'm interested in your comments to Laura Jays this morning. I want to look at those in a moment, but first up, your reaction to the stimulus. What did you think of it, and can it be delivered via appropriate Centrelink payments in your view?
Well, I think it's good that the government has said that it's going to do something to try and protect the economy with coronavirus. And I know that our leader, Anthony Albanese, and our economic team have been out there saying we'll be constructive, we want to study the detail. But I do notice in my own patch, in terms of Centrelink and government services, that the government, whilst it is looking after people who get sick and saying they can access some sickness allowance, what they don't tell people is that it takes 35 days for 70% of people to get their sickness payment, and the other 30% don't get it. So I'm concerned that without more resources to Centrelink, when people are sick, they think they're going to get reimbursed, they're going to be waiting a month and a half to 2 months. The other thing, of course, is that the government's package on my first study, and I could be corrected upon further detail, is that it does nothing for the casuals and the part employed who are not sick but have to self-isolate anyway. So in other words, are they going to be eligible for sickness payment, or are they just meant to sit at home for 2 weeks and starve? So I think that, and we can't ask small business to pick up the tab there, so for the 3.3 million casuals, I still can't see what the answer is. I mean, it's good that we're looking after the pensioners, tick. Good that people on Newstart, tick. But the 3.3 million people who go to work, who mightn't be sick but have to self-isolate, what happens to them? And what we don't want to do is push people into a situation where they either starve at home or they've got to go to work sick. So I think there's still plenty of questions to be answered.
Okay, well, the other question, and this really was quite stark, your warning with Laura this morning seemed to go well beyond any other figure in the major political parties. You're concerned, you want some more drastic social distancing measures now. Are you worried that if we don't move now, we'll be regretting it in just a few days, maybe a week away from now?
Well, I appreciate your commentary, but I thought I was stating the obvious. A lot of parts of the rest of the world are now putting in place measures which were perhaps unthinkable weeks ago. So, you know, Labor has been working with the government. There's been bipartisanship. I think the Chief Medical Officer of the Commonwealth and the states have been doing an excellent, excellent job. I know Chris Bowen's talking to them publicly and privately about what to do. But it just seems to me that, you know, any cursory study of what's happening around the world means that we're going to have to contemplate things in coming days which would have been unthinkable weeks ago. And my concern is that if we leave it too long to contemplate it, then this infection will spread. So I love going to events. I think events are great. But part of my challenge is that I don't want to be accidentally, you know, infected, but then more important than me, I'll get through any, you know, coronavirus like most people. But there are a proportion of Australians who are vulnerable. You know, I was talking to a teacher who's got a disabled child. She was in tears worrying about what will happen if she got an infection at school. I know another gentleman I was just speaking to on the way to the studio, 79-year-old parents, respiratory diseases. It's not that the people in Australia are worried for themselves, but surely if we see that in Japan and Singapore and other parts of the world, more social distancing measures are introduced to stop the spread of coronavirus, then it's really all about protecting the vulnerable. See, what happens if, you know, there's a bit of an attitude which says, oh, I'll be all right, I'll just get it, it won't be comfortable, but we'll get through it. That's true for most people. But what happens if all of a sudden our hospital systems are clogged up because we don't take more draconian measures earlier, is that more people will be in intensive care. And what happens to the cancer patients who need those intensive care beds? So I think it's not a problem with the government or the authorities, but businesses planning it. We've just got to start thinking about perhaps inconveniencing ourselves for the greater good.
The Prime Minister said, he was asked about this by Michelle Grattan today at the news conference here at Parliament House. He said, I'm going to the footy this weekend and looking forward to it. I'm sure many Australians would. I encourage you to, unless you're ill and unless there's a reason like you're in self-isolation. He said he'll change, if the advice changes, well then that they will change their position at that point. But what's your view on the fact that he's still saying he's going to the footy and encouraging others to in this environment?
Maybe he feels he's the Prime Minister and he doesn't want to be seen to take a backward step, and that's fair enough. That's his opinion and that's what he will do. But for myself, and this is a personal view, well, I might just watch it on TV, not because I'm worried about getting a virus, but because I don't want to be in some way accelerating the transmission to a vulnerable section of the community. This is not an easy question. I mean, I think we're all a bit conflicted. No one wants to see events cancelled and no one wants to be seen to be deterred by some invisible virus that we can't see. But I saw a really dramatic graph from the American Centre for Disease Control. It's the world expert body. They are just the best. And there's two humps, and one hump is one part of the graph is that if we just keep going business as usual, a lot more people will get infected. And for me, that'll overwhelm our health. It won't overwhelm it, but it'll put a great strain on our health system. Whereas if we take measures which now seem unpalatable, it just gets me wondering that if in a couple of months we look back and say, should we have perhaps, taken these measures and inconvenienced ourselves? But nothing that I'm saying should be construed as any critique of the response of the Chief Medical Officer or the medicos. I think we've got the world's best, and the bipartisanship, we're all working together. But just for the Australian people, I just think that there's a bit of a challenge there that we haven't seen situations like this. We'll get through it.
No.
The stock market will rebound, but I don't want more people to be gravely ill or worse because we just sort of wanted to delay making decisions which some countries are already grappling with right now as we speak. But I'm sure we'll get there.
Yeah, so, yeah, indeed. But as you say, the point is, even though the vast majority will have a mild experience with this, there is a cohort that will die.
That's who I'm worried about.
And so you're saying just shut down the stadium, shut down the events now?
I'm not going to say, shut down this event on this day or shut down that event. I'm not, because that then becomes the debate rather than what we're trying to resolve. What I'm really saying when I look at from the payment systems at Centrelink to the individual stories I hear in my electorate, people are worried about their parents and their grandparents. They're worried about the vulnerable. I'm worried about disabled people who mightn't be able to get carers to go and see them. And to make sure that we can get through this pandemic in the best possible shape, I think that's going to involve not just an effort of business or education authorities or politicians, it's all of us. And I think we need to make the message that it is going to be uncomfortable for a period of time. And but if we're all in it together, then I think that's the best way to get through this. All of us making a bit of a sacrifice. And I'm saying to my own staff that at different times they should feel if they can work from home, work from home. I mean, none of what I'm saying is rocket science. We've already had schools closed. We've already had, Dark Mofo cancelled. But I do think, and this is the point I was making today, that what's happening in the rest of the world, even with the fact that we're a large island and we've got excellent medical resources, we're not immune. And I just think that we need to be prepared sooner rather than later for the more draconian decisions, which maybe if we take too long to get to, people will regret that we didn't get there quicker.
Mr. Shorten, I appreciate your time. I think many viewers will relate to what you're saying right now. Thanks for that.
Thank you, Kieran. Cheers.